Hello everybody and welcome back to my YouTube channel. So as the pharmacist, as D pharmacist or as PharmD or even as masters, there are certain case presentations that we come across or certain cases that we actually मतलब हमारी लाइफ पे कभी ना कभी आते हैं, either resistance cases or tolerance or anything कि दवाई काम नहीं कर रही है, something like that, right? Like cephalosporins, second generation cefirexime काम नहीं कर रही तो cefipime दे दो या cefixime दे दो, something like that. So we always need to know when the tapering of dose is required, when the dose is to be altered, all those things. So today we'll be like actually having an idea of how to utilize the pharmacy knowledge, right? So this is a case that I've found. Okay, the question says that a 20-year-old woman with no previous history of urinary tract infection complains of burning urination, frequent urination of small amounts, and bladder pain. She did not have any fever or any tenderness of the bladder. A clean catch midstream urine sample shows the presence of gram negative bacteria. So इसका मतलब कि हमारा जो एंटीबायोटिक है, अगर ग्राम स्टेनिंग में साफ पता चल रहा है कि ग्राम नेगेटिव है, so we can go a bit rather than a broad spectrum antibiotic, हम एक narrow spectrum antibiotic that can target all the gram negative bacteria like Escherichia coli, Staphylococcus, Escherichia coli, and all. We can use an antibiotic that can target these particular bacteria, right? So based on these findings, we have to like give them a treatment regime or a dose regime, right? So it is presumed that it is a lower urinary tract infection. Now, how can you proceed with the treatment? So the duration of the treatment can be shortened, like 7 to 14 days ideally, and a 3 days antibiotic treatment regime is effective as a 10 days effective treatment, right? All belongs to the specificity of antibiotic. So जो काम आप 10 दिन में कर रहे हो वो काम 3 दिन में भी हो सकता है. कैसे? When we combine a particular antibiotic agents like augmentin, fluoroquinolones, and Bactrim. So we all know that there are different kinds of fluoroquinolones like ciprofloxacin, levofloxacin, sparfloxacin वगैरह. ये सारे जो है they are useful they are all useful in urinary tract infection. And Bactrim, sulfamethoxazole, it's a sulfonamide derivative, so it's like a combination of like जैसे cotrimoxazole, trimethoprim and sulfamethoxazole. So that can be useful, right? उसकी tablets आती है. Augmentin, so it's a penicillin, it's a combination of amoxicillin and clavulanic acid. अलग-अलग dose वगैरह में आती है 625 and all. So we can use these particular treatment, right? These particular preferred agents as 3-day treatment regimes. Besides this, we can also replace nitrofurantoins with sulfonamides or Bactrim with nitrofurantoin, because we all know that nitrofurazone and all nitrofurantoin, furazolidine diones and all, these all moieties are very useful in UTIs. Besides this, also tetracycline, oxytetracycline वगैरह भी काफी ज़्यादा appropriate है, but it is not for a short term treatment. It is a soft specify किया है ना that it is a lower urinary tract infection. So these are all for longer treatment regimes. So ये एक हो सकता है. Then these are the different sites where you can see case studies, because you need to know कि कभी ना कभी आपकी पर्सनल लाइफ में और एनी टाइम आप केस स्टडीज के थ्रू जरूर acquaintance रखोगे. And when you solve these case studies, आपको actually एक better experience मिलता है. मतलब theory knowledge तो ठीक है, हमने पढ़ लिया, broad spectrum इसमें है, we study that antibiotic class specific, this is there, this is against gram positive, gram negative and all. But rational regime, dosage regime, how do we set, when do we set dose alter करना है, वो सब चीजें आपको practical experiences के साथ आएगी. This is also again another website जहाँ पे आपको देखने मिल सकते हैं अलग-अलग case study. ये interfaces है. So ये जो website है Pharmacotherapeutics jaundice, आपको you get to know about different pharmacotherapies of different disease like icterus, that is jaundice, anemia, stroke, then there is thromboembolism, DVT, deep venous thrombosis and all, peptic ulcer, DIC, disseminated intravascular coagulation, PharmD case studies. So mostly PharmD people are more into these kind of studies. So you can also see cardiovascular, respiratory, endocrine. There are different kinds of case studies. Nervous system, there are central nervous system and its case studies. So you can see hypertension, angina, arrhythmia, heart failure, hyperlipidemia, asthma, COPD, diabetes, oral contraceptives, osteoporosis, rheumatoid arthritis, autoimmune diseases, certain, right? So these are the things that you should know. So ये वीडियो काफी मैंने short रखा था. I thought that 5 minutes में I want to share across a case study so that as pharmacists, you know, हम कोई भी फील्ड में जाए, भले एनालिसिस कर रहे हो, whatever we are doing, masters or anything, basic thing तो हम सबको पता है. We all have studied B Pharm for 4 years, so we have all are being in acquaintance with the classification of antibiotics. मतलब मैं किसी को रात को भी उठा के पूछ लूं कि tell me cetirizine क्या है, तो पता ही होगा कि it is for cold and all. So this is what is about case study. So that's it for today's video. I hope आप लोगों को बहुत कुछ जानने मिला होगा, and ऐसे ही लाइक शेयर सब्सक्राइब करते रहिए मेरे चैनल को so that मैं और आगे बढ़ सकूं. Thank you so much.